are back and we are moving into our first conversation for today. Of course, we want to keep you updated as to the preparations that are underway for the COVID-19 pandemic, and of course focus on how we can prevent the spread of the virus. This morning we're having a conversation with representatives of the healthcare system. We have with us the CEO of Karl Heusner Memorial Hospital, Hoare, and we also have the Regional Health Manager for Central Health Region, Melinda Guerra. Good morning.
Good morning.
And welcome.
Thank you.
So ladies, it's been a lot of work, I know, in getting to this point, and up until this morning, there is no confirmed case of COVID-19, right? Let me just start off by finding out where we are in terms of the preparations, specifically for the healthcare system in Belize.
Okay, with regards to the preparations, as everybody is familiar, very early in January, as soon as we heard about the outbreak in China, we started our preparation. But this is just, actually, we heightened the surveillance system that we had, because our surveillance system is something that we have ongoing throughout the entire year, 365 days, for any communicable disease. So what we did in this case is that, we actually updated our plans, and now where we are now is that actually we have the response plan now as to in the event that we are able to detect that first case of COVID, the presence of COVID in Belize. So, we are working on all the different activities, the action steps that we are going to be taking, so we are ready. Actually, we have been working very closely with Mr. Al Westby from NEMO, who is the regional coordinator, and we are setting up our different areas where we are going to be responding from. Okay?
So you coordinate with NHI clinics, with private health centers to monitor cases that are coming in, right?
Yes. So what we have been doing again, from the onset of this COVID-19, that in Belize, once we saw that COVID-19 was moving, was in China and moved out of China to different areas, and then of course to the United States, then of course we have been monitoring this on a day-to-day basis. So what we did all the while is that, based on the best public health evidence that is out there, we actually carried out our health education, so that persons at all levels, community and responders, will know actually how to identify and manage any exposure. I think that is very important, because we need to know that, or we are aware that in Belize the risk was high because our border is still open, where we have Americans coming in, and different countries, persons coming from different countries, where we are having community transmission. So based on this, we have all our healthcare workers. We brought them in. Actually, this week we brought them in from, including the NHI clinics, private sector, and then we are outlining the plan of where we are right now, where we have the different teams to respond to different situations. For instance, we have right now, we have identified, starting from the clinic where we are actually isolating patients, or the way how we are managing the flow, how we are managing persons coming with influenza. That's the first step we did.
So any flu-like symptoms, they have a different...
Redirected, yes. Okay. So it is a different area in all the clinics that is happening, even in the rural areas.
And at KHMH as well?
Right.
Okay.
Yes. From there now we identified the areas where, for example, when we have our first positive case, where we are going to be managed in this case, and then of course contacts where we are going to be directing them.
So let's start with the first question in looking at suspected cases. What qualifies as a suspected cases, and how many suspected cases have been testing?
Okay, so far we have like over 25 tests that we have done so far. But what qualifies as a suspected case is that, of course, everybody should be familiar by now that if you are having fever, that's the number one point. And then if you are having any signs and symptoms of either like fever, like a cough, cold, shortness of breath, then that would be the second indication. And if you are coming from a country where we are having cases, or in this case now we are having community transmission. So we changed the definition now to say, if you are coming from a place where there is community transmission, fever and ill. So that would qualify for us to investigate. And then you come to our clinics, then we would investigate. On the initial phase, when we just started testing, of course, it was just persons who were traveling from person, but now that has been changed. CEO and myself and the Ministry of Health, we have been in communication right now where we actually are heightening our testing.
Yeah.
Okay, so we are saying anybody that presents and fits the case definition, then we are going, even if in some instances, even if the person is asymptomatic, we are still going to test at the discretion of the clinician, of course.
You received the test from PAHO and had the training done about a month ago. So in a month, we've done 25 COVID-19 tests.
It could be around that number. It could be
Okay.
more. And as the days go by, we increase the testing.
Okay.
Like today, we have another a set of tests to process.
So I think the concern that a lot of people have is that maybe the healthcare systems have missed a case of COVID-19 because perhaps the criteria that was used to identify whether or not they should be tested didn't allow them to be tested. Is that a possibility?
Well, as in anything, a possibility would exist. But again, we have been discussing with our clinicians, with Karl Heusner, where we are actually more vigilant. Are we having pneumonia cases? Are we having cases of respiratory distress complications?
Yeah.
So this is where now all physicians, even in primary care and at our hospital, it's countrywide, they're actually monitoring very closely any case that would present with those symptoms, and then we are going to test whether you traveled or whether even if you were
So
just
once you go in with some kind of respiratory, I need oxygen or additional care, that would be a critical situation to be tested.
Yes, of course, because we also have private doctors.
Yeah.
So what we are encouraging them and encouraging our clinicians, we have an investigation form that we have to apply because we cannot be just testing everybody. More or less we have to have a guide. Of course, we have the case definition and this tool that we apply, and based on that tool and the doctor, if the doctor has a high suspicion that this might be a case, and he say, I think we have we need to test, so they would call our focal point officers in Belize district and in the other parts of the country, and then they would test that person.
So the entire country is monitoring the cases coming in. All the healthcare workers across the country are monitoring cases coming in for suspected COVID-19. And the question now is what happens if and when we do detect that first case. And so, I know, CEO, we have discussed, you've explained to people what preparations are being made at the KHMH, and there are concerns. So let's start with that first. Where are we in addressing the issues that the unions have raised?
Well, we are still having critical cases being managed at KHMH.
Okay.
I think early on, the discussions with the Ministry of Health and the region is that the region, depending on where the case shows up, the region will contain as much as possible the case within the region. So whether it's a private sector facility, the regional health facility, the agreement was or is that the facility should contain the case. Of course, they have their own isolation units set up within or near the facility.
Okay.
KHMH is the national referral hospital for the country, and so it has been agreed at ministry level that KHMH will only receive referrals for critical patients. And so with that said, we had to look at our existing space that we had, and knowing that we would not have wanted the virus to be in circulation with our general hospital population, we had to identify an area within the facility but away from the rest of the general inpatients where we would manage critical cases should they require admission. So that's the plan. That is still on the table. We have gone ahead, made the preparations because, from the first call I got from Melinda in maybe the last week of January, that activated us.
Yeah.
Because we were informed at that time that they have heightened their surveillance activities. So even before the ministry said heighten surveillance activities, we activated that level of preparation at our facility. And so using the case definition, we adjusted our triage forms and made all the necessary preparations to ensure that our people are now looking specifically for cases that fit the COVID-19 case definition.
So the concerns from the unions, they're rather specific.
Right.
When we look at the isolation unit in particular, there's some concerns raised in terms of cross-contamination that may take place. In other words, that you may take COVID-19 and pass it on to another person who does not have it. And it's as specific as looking at the door infrastructure that's there, to the air conditioning unit and the air that passes through. Have you been able to address any of these specific needs?
We have discussed those specific concerns that the union raised in terms of the cross-contamination for the union is not within the unit, but outside of the unit to the general hospital population. And so we've looked at some of those with Ministry of Health, and we've agreed that if time permits, we will be able to maybe change the doors and put in glass doors that seals better. Of course, it all depends on how much the supplier will be able to prepare and get it in for us. We've already activated that. There were some concerns, and that had to do with the door handle. In terms of, and of course they had some concerns with seals around the door. One of the big issue is that while the transmission has not been classified as airborne transmission, it is still classified as droplet, right? Just recently, the time for suspension of the droplet in the air has just been released. We don't know if the ministry or the source would have been accepted as an official source. It was a study that was done that was released. But we look at the infection control component of it, and we started considering that, listen, if it's still droplet transmission and contact spread, then the measures that we would put in place would have to suit the mode of transmission of any pathogen that is in question. Whenever you're setting up any response for even patient management, you need to be clear, first of all, what's the mode of transmission? What's the virulence? What's the susceptibility? You know, different issues relating to those types of public health and infection control concerns. And so those were considerations that we made. And for the mode of transmission, the area that we have in place will be able to contain the virus, right?
And if it does in fact stay in the air for, what are they saying, 3 days?
They're saying, no, 3 hours.
3 hours, sorry. 3 hours. What are you accommodating for that? That's what one study said. It doesn't come, I mean, you're right, there are studies coming out regularly.
And, well, since that release, of course, our maintenance group team on the ground, of course, we have an engineer trained in that area. So they're also looking at the pressure, you know, the suction. And they've already been looking at how they could increase, you know, the suction coming out of the room, because that has to be a concern. There are also what we call a hierarchy of control that you need to put in place when you're dealing with infection control issues. And there are several things that needs to be addressed. You try, first of all, you try reduce or contain the pathogen, the virus in question. For us right now, that's COVID-19. How do we do that? The first thing you do at the first contact or the first observation that someone has flu-like symptoms, you give them a mask. So that is reducing.
So that's in your triage area.
That's even before they reach emergency. We have masks available that, you know, with the signs that says, if you have flu-like symptom, pick up a mask.
That's at the gate at the KHMH.
At KHMH, and that has been put in place for some time. At triage now, within the emergency unit, if a patient missed that point, right, and did not pick up a mask, and that will happen in triage. All right? the nurse will screen, they will classify the case following the case definition.
Yeah.
And if they identify that, yes, indeed, this case fits the criteria that was presented, that was approved by the Ministry of Health, then they will be placed in containment. And that's a room immediately behind the triage area.
Have you considered already using, you spoke of an isolation unit in some of the public clinics, already using a separate entrance for people with flu-like symptoms? Let's use the pink eye infection for example. After a while, once you had any suspicion, it was suspected you had pink eye, you were put outside to wait to get your medical care.
Yes.
I'm not saying people with flu stay outside, but I'm saying should there be a separate entrance to separate the people who may be coming for whatever it is they need versus a potential case of COVID-19?
Of course. And yes, we have implemented now, we've moved initial screening from within emergency to the gate.
Okay.
All right? And so now persons will be redirected.
Okay.
At that point, they will be asked the specific questions. If it fits, then they will go
Okay.
in a different direction, right? Away from the emergency department.
Yeah.
If, for whatever reason, there are other emergency issues that we have to deal with, and the patient does not meet the criteria for COVID-19, right? Suspect case, then they will continue on to
The regular waiting
in-
or triage area.
and there will be a second level of triage again in that area where
Okay.
persons will be managed. So there are a number of steps and movements that, you know, the flow has to be such that you identify early and move persons in the, you know, in the right direction. And so the area that was identified for isolation is within that proximity, as you all are aware.
Okay.
I want to shift just slightly to sort of the preparations that have been made if and when we do actually have a confirmed case. When it comes to treatment, you know, abroad, we have seen issues with things like shortages of ventilators or what sort of, or you know, even equipment to sort of manage the symptoms of somebody who is experiencing or who is infected with the virus. So what sort of preparations have been made to actually, with regard to actual treatment of persons with this, with the virus?
Okay, as I said, cases that will be admitted in KHMH isolation will be for critical care management. And so plans to increase the number and availability of ventilators, that was put in place very early in February. And so we went ahead and we had to procure additional ventilators and other equipment that would have been required. Identification of a portable X-ray machine, you know, and those types of things. And within the facility
But do we
itself,
have them already?
we have them already.
So you got your portable X-ray machine.
We have a portable X-ray machine that we remove from circulation,
Okay.
and when we get the new one, which hasn't arrived yet, we will put
Into the regular
replace
X-ray
in
room.
the area where we have.
The ventilators, how many do we have?
For the isolation area, we have capacity for 4 adults and 2 children.
And the rest that can be utilized from the hospital?
We have a backup of like 3 additional. The only problem is there will be no the ports, the oxygen supply. So we have the backup for the ventilators, but not enough ports, drops, you know, the piping system.
I know, for the oxygen.
right?
Yeah.
So that is something that could be looked into. We have already discussed the possibility of adding ports, but the problem with that is that engineers are outside of Belize that actually come in and do that. So it will be.
So I want to help people understand this. This is like when you go to the hospital and they have the wired tubes that they can put the oxygen in, so you can be able to access it. The breathing, that's the ports that you're talking about?
No.
Or just the ones on the walls that you can be able to access?
It's 2 levels of supply of oxygen.
That's
we
right.
have piping system that supplies the ventilator.
Yes.
And then you have stationary, movable
You have stationary.
tanks.
Okay.
That if you only need oxygen therapy, we have tanks.
Yeah.
And we have enough tanks to be able to allow for that. So You might be on the ventilator or you might just need oxygen therapy.
Yeah.
We have oxygen tanks and we've bought additional regulators and whatever it was required for us to just have additional supplies of oxygen for that area.
Yeah.
I think it's like we've added another ward in the hospital, right?
Yeah.
2 to be exact. And so we had to think ahead, looking at all the equipment and supply needs to be able to manage those areas adequately.
And the isolation unit holds 8 beds.
8 adults, and it has capacity for 2 pediatric, and a space if we need to do any delivery, that could happen in there. You know, God forbid there's a expectant mom exposed to or confirmed with COVID. We've also planned for that as well.
You wanted to add something?
Yes, what I just wanted to add, because you spoke about ventilators and but what in public health, what we have been doing, you know, from the inception of January, that we have been carried out public health messages to the public with the aim that communities and responders from the different departments, they should be able to identify their own risks right now and manage that risk. So we hope that probably that's where we are right now, that people are doing organization, hospitals, frontline people, they're actually practicing these measures, because if we make sure that we practice all the preventative like hand washing, the social distancing, guarding, minding your own space, the coughing and sneeze etiquette that we were saying. So if we practice all of this, then we are hoping that people are going to get less persons are going to be infected. And even earlier also was mentioned that probably suppose we have a case here. Well, if suppose we have a case here and if that person is being isolated, you know, self-isolate again, there's no way that that person can infect another person.
Yeah.
So hopefully if we manage and if the persons, as soon as you know, be it a healthcare worker, if you have your own PPE, let's say if the PPE would tear, then right away the person will know that's a risk. Or for example, if you're just at our clinics right now, persons who are coughing, of course, they're isolated, but even we went to another step, that those persons in that area who are waiting, we are saying, okay, you know what, we have to have identified those persons who traveled and who are having fever and cough. So immediately out of that group of persons who are at that area for the flu, we move them out of that area. So immediately because the less amount of time any person has within that group, then you know the less exposure. In addition to that, we have, for example, we have our immigration officers. We have the media houses, I would take for example. You all need to know who are your person's underlying conditions. Ms. Michelle mentioned a while ago pregnant women. We said the elderly. We say people with immune conditions, immunocompromised, diabetics, hypertensive, problems with the heart, with the lungs. So, you know, we have given, the information is out there. And I'm glad, Marlene, that, you know, here at Channel 5, you are all sharing this information on a daily basis. So once people are aware of what I am supposed to do, so we don't have to wait, you know, for COVID to come here to know that your diabetic shouldn't be at the front line, or that pregnant women, you know, shouldn't be out there exposing themselves, or the elderly. As a matter of fact, right now, we had a meeting with all the different home for the elderly, and there's restriction right now. So nobody can go and visit those places right now. And even the measures that the persons who are working there, what we're doing is that persons who are coming, they have to change their clothes, wash their hands before they come in contact with the elderly, taking their temperature. So if we actually practice all of this within the different organizations, the different schools, different departments, be aware of your risk. Be aware that you can identify that risk, and then you manage that risk immediately. If I know I'm a traveler and I'm coming from a country where there's community transmission, right away I must assume that personal responsibility, stay at home. You should not be told stay at home, because you know what, at the end of the day, you are putting everyone at risk. Now, when it comes now to our health workers too, in the hospitals and the clinics, we have to make sure, and what we are doing is that there's intensive training on how to wear your personal protective equipment. And we have to guarantee that to them.
So they're being trained or retrained really on how to put them on.
So hopefully that is the gains that we have in our public health sector, that people are going to practice what they need to do. So at the end of the day, we will not need all of those ventilators, all of those respirators,
Have we
will not need that.
acquired enough, you say PPE, the protective personal equipment that the healthcare workers have to work? Because we're seeing in some of the more developed countries that they're running out of this type of gear.
What I can tell you, probably I could just share from my part, from the Ministry of Health, is that just like in any system, we will never have enough. So what we are saying to our persons out there, if you have, let's say the N95, you have regular people wearing N95, you don't need to wear that. Who needs that is the healthcare worker.
That's right.
The ones who are going to be attending to these persons anytime we identify COVID in country.
Yeah.
So Marilyn, the answer is no, we don't have enough, but we're supposed to use what we have very efficiently.
Yeah.
And people need to know that even if you have it at home, bring it to the hospital, donate it to us because we need it.
Yeah.
Okay, Michelle?
Ladies, I think one of the
At your
things that
place.
is very clear, and I want to set this here, the preventative measures that's being hammered into our head
Yes.
is with a purpose.
Exactly.
Because no country has been adequately prepared for COVID-19 so far. And we have the benefit of being late to the game, or maybe never, to know that there is the potential for an overwhelming of the healthcare system. So we can do all that we can to encourage people to wash their hands, social distance, so we don't get there. But if we do, we want to know that you're prepared as well.
And we are.
So I have a question. The total capacity, so eight beds for adults, 2 for children. That's 10 severe cases. So let's look at the numbers that we do know. And I always say we don't know everything about the virus. It changes very often. What we do know is that about 80% of the people who do get COVID-19 may not know it. They may be mild, a little fever, maybe a cough, maybe nothing. 20% though may require hospitalization. And it's not just a one-stop shop. It is a sustained number of days, maybe a week or two, of oxygen care. And the very severe one, that 5% of that group, may need ventilators. So that's where I think that the concern is. Will we be able to handle, if people fail, and that's what's going to happen, if we all fail in protecting each other, and we have that in place, how can we be assured that everything is being done for the worst case scenario? So the total capacity in KHMH is what, 100 plus beds?
134 beds. Inpatient beds, we have 189 beds totally, but inpatient beds, because the beds in emergency we don't really count as inpatient bed, and labor and those areas. So we have the capacity. The message is, the plan is, critical care patients at KHMH, the region now, because KHMH, and I think the country needs to understand that for Central Health Region, KHMH serves as the secondary care facility for Central Health Region. So there is no other hospital under the Ministry of Health for Central Health except KHMH.
So I think we should explain that. So in their regional hospitals in the south, there's a clinic in each area, but then there's the region for south, region for west, region for north.
Right.
And KHMH is kind of a regional. And you
Regional
also
and
do the
National.
critical care. So if something serious is in southern regional, western regional, northern regional, it also comes to KHMH.
Right. But what we also need to be aware of is that the Ministry of Health has enhanced the responsiveness of the regional facilities so that they will be able now to manage a little more, right? So they would have to now look at how you classify the cases for isolation. Not everybody that requires isolation needs to be in the hospital.
Okay.
So those types of classification, right, would have to be very clear and complied with, right? So that we just keep the numbers very tight for patients who need hospitalization, and the region now has heightened their responsiveness to be able to accommodate that. Central Health Region has gone beyond what their
And probably
their
I will
mandate,
share.
and so they too And Melinda, you could explain how
Yes.
that works.
So what we are going to be doing now, because to support Karl Heusner, as you heard, just the limited space that they have. So now we are going to be using the Cleopatra White Health Center as a backup to Karl Heusner. So right now we are ensuring that we have all the supplies there, because now anytime Karl Heusner has patients that are between the mild, moderate, that probably only need IV therapy, oxygen therapy, hydration, then we are going to be managing those persons there on a 24-hour basis. So we are going to be having our staff there who are going to be attending to this person. Of course, you know, we have forwarded a budget to the Ministry of Health for additional resources that
So
we have.
you will now take, this is the phased approach. When we
Yes.
reach the point where there are cases, severe, and people who need some sort of hospitalization or care at the hospital, those cases will go to Cleopatra White.
To Cleopatra White. No.
And then the very severe ones will remain at the KHMH.
Yes, so now we are going to be managing these patients there. But when we identify the first positive case, COVID in Belize, the presence of COVID in Belize, and we have that first case, then depending on where that case is identified, if it's here for the central region, our plan is that if the person is positive, the first case, we're going to self-isolate with the Ministry of Health. And for that, if the person can, the options are this, that if the person is positive, we are going to do self-isolation at home. That's for the cases, okay?
Positive and asymptomatic.
Positive, and it's positive, no. It's
With
a
mild-
positive confirmed symptom, just that the person is ambulatory, the person will go home. But we are saying the first cases that, you know, we are going to actually take it on our own and self-isolate them. Where are we going to self-isolate this person?
Yes.
It's going to be at the hub, right by the Chetumal
Okay.
Boulevard.
Okay.
Yes, so we have been working with NEMO, and they actually, you know, have given us that place so we can work with them, identify the spaces, do a plan of how we are going to be, you know, having our patients there.
Okay.
So that's for the positive isolated cases. In the event that we have any healthcare worker,
So for people who
Any-
can't self-isolate at home, or everyone who needs to isolate?
well, in the initial phase, we are going to isolate the first cases.
Okay.
But as a follow-up plan now, you know, of course, the public health inspector and the public health nurse, they're going to go and visit your place. If the place is adequate and if the person can, with certainty, you know, is going to cooperate with us
Okay.
and take all the measures to self-isolate, we're going to have the home self-isolation. Okay, of course, this comes with follow-up, daily follow-up from public health inspectors and public health nurses.
Okay.
Okay, if you can't self-isolate, then we take you to the hub.
Okay.
Now, if you're the contacts of those positive cases, we are going to take them to the Mexican Sports Complex. What are the contacts? Contacts are those persons who have been in touch with a positive case.
Okay.
Okay? And then we also have like a floor plan of how we are going to be moving the person within that complex. Because remember, we cannot be moving persons because persons can get reinfected.
That's right.
Both at the
And they may be not
quarantine
infected and get
yes,
infected.
we have a plan of how we are going to be moving those
Okay.
persons.
So there's been, what I'm hearing from you now is that there's
Yes.
been a lot of thought given to this now in terms of how do we minimize, once that
Yes.
first case is possibly detected, how do we keep it as low as
Right,
possible?
right.
So the first thing is that case, whether it's in any part of the country, they'll be isolated there,
Within their, yes, within
right?
their
They won't
areas.
necessarily come directly
Right.
to
No.
KHMH.
Right.
If you will go back and find out who they had contact with,
Yes.
right? Those people will be tested.
The contacts?
No,
Yeah,
not
they're from the
The
contact
contacts-
tracing.
No, the contacts, you know, that's where we actually look at the case, analyze the data,
Follow them.
and then we follow them up on a daily basis.
Okay.
And then we decide, okay, who we test. Okay?
So if there's people who are positive but asymptomatic, they will be held at
The hub.
the hub.
At the hub, yes.
All right. And if there are people who are positive and require the preliminary care, IV treatment, oxygen
Oxygen
therapy,
therapy.
they'll be at Cleopatra.
Yeah, Cleopatra White Health Center.
And if someone is severe, has, you know, co-infection, the other diabetes, hypertension, elderly, very severe, requires maybe up to ventilator care or who knows
KHMH.
what else,
Karl
they'll
Heusner.
be at KHMH.
Right.
Probably right now the public might be wondering where will we go now if we are using Cleopatra White for as a secondary care facility. Okay, what we are going to be doing is persons who just need like diabetics, hypertensives, they are going to be directed to the other NHI clinics and matron robbers. We have in the plans right now where we are going to be setting like just an influenza clinic based on the numbers that we start getting. So we are going to designate a place just for influenza. Okay, so we are going to be redirected, and the other outpatient cases, like as I mentioned, diabetics, hypertensive, you probably just need to go and consult with a doctor, then you will go to the other facilities, matron robbers and the other NHI clinics.
Do you have a designated process of transferring cases as well?
Yes, we have our procedures. We have
Yes.
designated procedures of how we are going to be managing this facility from the time you come in to the time you are discharged from the facilities.
Okay.
Yes, we do have.
Okay.
I think what I would also like to add is that while we understand that the flow will and the separation of cases will be done in a particular way, particular attention has to also be paid to the healthcare workers who is actually in close contact with these persons, right? And so this is where the PPE comes in, the personal protective equipment. So depending on where you are in terms of the level of involvement with the persons under investigation or confirmed cases, then there is a special way and type of personal protective equipment that the healthcare worker will need to use. And so as the contact escalates and the level of involvement, meaning intubation, nebulization, you know, intravenous therapy, you have to be right there in these people's faces, you know, have to suction them, then this is where the full body PPE comes in.
Okay.
And so in addition to
That's the hazmat suit.
the
looking
full
suit, yeah.
PPE suit,
Yeah.
hazmat looking,
Yeah.
not hazmat. So so we need to consider that the flow is one, separation is another level. The space, the contained space for isolating patients, that's another level, added protection, right? The procedures, the work processes, all these things come to bear, everything comes together, and then the PPE, right? So it's different levels of protection. And so when you're looking at the responsiveness and the management of these types of cases, we have to take everything into consideration, right? We can't just look at the building.
Yeah.
We have to look at the policies, the
Well, I
procedures,
do-
the you know, the PPs, everything comes together.
I do have a question there, because what is the level of monitoring even from now that you're having with healthcare workers? Because healthcare workers are like any of us. They may have it, they may have mild symptoms, they may be bringing it into the hospital. Is there already like just a basic monitoring that's taking place?
Well, the managers, supervisors have all been informed that you need to take note of staff members who are coming to work ill. If they're presenting with, some of them would call in, first of all, right? They would call in because we do have flu-like symptoms still among healthcare workers. So they would call in and they would get their certified sick leave. And so you monitor that. And of course, we're going to heighten now to look at those persons who now within our inpatient care area, right, who may fit the criteria for COVID, that may have already been in the hospital, didn't present with the symptoms when they come in, but might be developing symptoms within the facility. So we have to track that as well. So it's not only at the isolation area, it's throughout the entire facility. I mean, visitor restriction is going to be applied, you know.
Yeah, I just wanted to add that with the question as to healthcare workers, you know, what we are doing. Yes, we are ensuring that they have the necessary personal protective equipment, but most important, we are looking at their mental health state. Because we know healthcare workers are going through a lot of stress, a lot of anxiety. I mean, there are a lot of issues out there, especially with the social media. So we have to remind them, and we are having meetings at Central Health right now, where we're reminding them, you know what, you need to have confidence and trust in your abilities, in your skills. And for those officers who probably, you know, feel like I need to still fine tune, for instance, taking a swab, you know, we said, you know what, we are going to train you how to put on your PPE and remove your PPE. We are going to do training. What we are going to do with you when you have to go along, just like the other persons, where you have to self-isolate yourself. Because remember, these healthcare workers are the front line. And then they also have to self-isolate themselves just like the regular persons who are at quarantine or at the isolation area. So it's a number of days that they're going to be away from their families. So we have to reassure them, yes, we know we don't have a perfect system, but nowhere has a perfect system, but we can guarantee them, as managers and as CEO at the Ministry of Health, to our CEO there, guarantee them that, we are going to do everything possible to protect and safeguard their health.
Yeah.
But again, it's a personal responsibility now. Like I mentioned before, everybody needs to be able to identify their risk and then immediately inform us of any incident, any concern that they might have, so we could address those issues there. Because we don't want situations where they don't know what to do.
Yeah.
So when you find, when we are addressing like our first case, especially the physicians and the nurses, they should be very calm and confident, knowing I can do this job. And I can tell you, they're doing an excellent job, our healthcare providers. So we have to commend them highly.
So two things. One, are we still doing elective surgeries and all the other stuff within the hospitals? And will there be a point where you no longer allow that?
Right. We have not suspended elective surgeries yet, but we are considering to scale back a little.
And what about the general clinic that you have?
Right. Also, that would be a service area that we will reduce and start reducing the clinic visits and eventually just close that down for a while. Right, and try to manage that from the outside.
In places like Cleopatra, Matron Roberts, NHI clinics, is it a good idea for people to come in for minor issues that perhaps can wait? I mean, if I have a back pain that I've had for 10 years and today I want to go check it, do we give advice to people that perhaps you visit if absolutely necessary?
That's what we are saying, come to the clinics unless it's really needed for you to come. Right now we are providing medication for 2 months for all the chronic patients. We are bringing our pregnant women who are high risk so that the gynecologists can, attend to them as early as possible before we even detect any first case in Belize. We are making sure that women have their contraceptives right now. We are ensuring that that we carry out the necessary home visits with the mental health patients too, making sure that we have that process in place where people have their treatment. So we are asking, unless you really need to come to the health center, come. In addition to that, we are saying, if you think you are a positive case, you have been exposed, Belizeans know what is exposure right now. So if you think you are coming from that high-risk country or in contact locally with a person, a visitor, who might be a potential case, you need to report it to us, and then you need to call us, and then we are going to be doing home visits.
So you may not even need to go to the hospital or clinic.
You need to give us a call.
You can call and you will go to them.
And I can say that the numbers are already dropping. Even before we implement that level of reduction, the numbers are dropping. People are already, staying at home and trying to
becoming more aware of
trying to be away from persons who may be potentially infected.
What's your message of reassurance to the public? I think again we can always underscore, let's do all the preventative measures that we don't end up in a situation where we have a critical number of cases. But how do you reassure that Belize is as ready as we can be?
Belize, just listen to the public health information that's coming out. Ministry of Health has been bombarding the public with information, answering questions. Listen to the information coming out. If you're not sure, ask an official source for information, right? The main message right now is don't panic, don't be fearful, because fear breaks down all the plans that you've put in place. It does more damage than the actual infection itself, because it propagates negative, and it is something that at this point it's very hard. The healthcare workers are already strained in terms of
preparing,
the mental preparation for this fear of the unknown. And so we are also working with our healthcare workers, trying to help them to understand. They share the information, let them understand that we are ready. We've been acting, we've been planning very early. We might not reach them with the timeliness that they would like, but we are here, we are ready, we've always been ready. We've always managed infected cases in the hospital, maybe not clusters of infected cases, but we've done it before, we've been successful, and we can do it again if we remain united and strong. So that's the message.
And my message to the public would be, and even to the responders, would be don't bring down your guard. We might still be negative in the coming days and weeks. Belize has a very good public health system. I have seen the response from the public health out there. I have been seeing the response from the different stakeholders. PAHO, great support given to us. So we are, like how Ms. Hoare mentioned, yes, we are ready, but you have to make sure that you continue practicing all the measures, all the preventative measures, and also be aware that the minute you think you are at risk of contracted COVID, or probably you think you're a suspected case or coming in contact with somebody who traveled, as I mentioned before, get in contact with us, okay? We are ready to investigate. We have our teams ready to investigate any outbreak, and our teams ready also to be supporting the quarantine building, the isolation building, and at Cleopatra White Health Center.
And that hotline number is 0800 MOH CARE, right? That's where you call for questions. That's where you call if you think that you may possibly have the symptoms for COVID-19. And you can call from any part of the country.
Yes.
All right. Thank you very much for coming in and giving us the latest update, and best of luck with the weeks ahead.
Thank you.
Thank you.
We're going to go ahead and take a break. When we come back, because it is National Hand Washing Day, because you have little ones at home, we're going to be talking about how you transfer germs and how to wash your hands properly. So please stay tuned.